Assalamu alaikum. I'm Muhammad Umar and I'm student of pharmacy from University of Central Punjab, Lahore, and I'm going to share some information about the drug aceclofenac. Let's start with the introduction. Aceclofenac is a phenyl-acetic derivative, non-steroidal anti-inflammatory drug with marked anti-inflammatory and analgesic properties. Aceclofenac is indicated for the relief of pain and inflammation in osteoarthritis, rheumatoid arthritis, and ankylosing spondylitis. Here is the picture description of osteoarthritis and ankylosing spondylitis. Discuss the pathway of inflammation and pain. First of all, external stimuli acts on the cell membrane and releases phospholipids. Phospholipids then react with phospholipase A2 enzyme and secretes arachidonic acid. Arachidonic acid further reacts with COX2 enzyme and it releases prostaglandins, which are pain and inflammation mediators. Coming on to the mechanism of action, the mechanism of action of aceclofenac is largely based on the inhibition of the prostaglandin production by selectively inhibiting COX2 enzyme. This is the picture description of mechanism of action of aceclofenac. Moving on to the pharmacokinetics, first of all is absorption. Rapidly and completely absorbed after oral administration. Peak plasma concentrations are reached 1 to 3 hours after an oral dose. Highly protein bound and presence of food does not alter the extent of absorption, but absorption rate is reduced. Drug remains unchanged. Moving to the distribution, after multiple dosing, aceclofenac penetrates into the synovial fluid. Then comes the metabolism. Major metabolites are 4-hydroxyaceclofenac. Other metabolites are 5-hydroxyaceclofenac, 5-hydroxydiclofenac, and 5-hydroxydiclofenac. Then moving on to the elimination. The main route of elimination is via the urine, where the elimination accounts for 70 to 80% of clearance of the drug. About 20% of the dose is extracted into the feces. Then there comes the half-life. The plasma elimination of half-life of the drug is approximately 4 hours. Then comes the pharmacodynamics. COX2 is an inducible enzyme involved in the production of the inflammatory mediators in response to the inflammatory stimuli. Although the mode of action of aceclofenac is mainly the inhibition of synthesis of prostaglandins, aceclofenac also inhibits the production of inflammatory cytokines, interleukins, and tumor necrosis factors. Then comes the dose. 100 mg tablets twice a day taken orally with or after the food, and it is not recommended for patients under 18 years of age. Then comes the side effects. Most common side effects includes dyspepsia, abdominal pain, nausea, diarrhea, flatulence, gastritis, constipation, and at the end, vomiting. Then there comes the contraindications when not to use aceclofenac. If you are allergic to NSAIDs, then you must not use it. Or if you have heart problems, then you must not use it. And if you have kidney and liver problems, then you must not use it. And if you have ulcers in the stomach, history of bleeding in GIT, and if it is the third trimester of your pregnancy, then you must not be using. And at the end is the toxicity. If toxicity occurs, then what measures you need to take? First of all, within 1 hour of injection, activated charcoal is considered. In adults, gastric lavage is also considered. Then, good urine output should be ensured, and at that, in case of frequent or prolonged convulsions, patient should be treated with intravenous diazepam. This is all about the aceclofenac. Thanks for watching my video.